Hello, I'm Emma Revell, Head of Communications at the Institute of Economic Affairs, and I'm joined today by my colleague Christopher Snowdon, Head of Lifestyle Economics, to ask if coronavirus has made us reach for the nanny state. But before we get started, don't forget you can follow the IEA on all of our platforms. That's the IEA London on YouTube, Twitter, and Facebook, and you can find our podcasts on Apple, Spotify, and Podbean. So, Chris, you've spoken throughout the coronavirus pandemic about the desire in some quarters to find a lifestyle factor that links the worst outcomes from the pandemic. Why do you think some people are so desperate to link COVID mortality to smoking or to obesity? And have they got a point, or is it a reach?
Partly, I think it's because a very large part of the public health movement has been focused on these issues for so long and actually doesn't know very much about virology and genuine epidemics of infectious disease. I mean, this is just a fact. And also, I think amongst the public, this is maybe a little bit more speculative, but I think if you look at previous kind of plagues in history, there's always been a search for a scapegoat, very often heretics. And perhaps there's a feeling that in some way this disease can't be totally random in who it affects and who it kills. There must be some moral reason behind it, maybe. And if people haven't been following the kind of clean living advice of the last few decades, then they must be more susceptible to it. But with the exception of obesity, which we'll come to, there really isn't any evidence for that. There's very little evidence at all on alcohol. Public health agencies have said from day one that you shouldn't drink because it might affect your immune system. Well, you'd have to be drinking a lot for it to affect your immune system. And such evidence as I've seen shows just no difference at all between drinkers and non-drinkers when it comes to getting COVID or getting seriously ill from COVID. Smoking is even more remarkable because there's really quite a lot of evidence now showing that smokers are, my interpretation is they're less likely to get it in the first place. Some people think they're just less likely to become seriously ill with it. I'm not so sure. It seems to me that they're just underrepresented amongst cases. If you just test people, there seem to be fewer smokers. They are also underrepresented in hospitals, which of course is also consistent with them not getting it in the first place. And that's never really been much investigated, considering potentially how important that could be. I mean, let's say that nicotine has some effect that builds up some sort of resistance to getting it in the first place. That's really quite significant. I mean, if we're talking a reduction in risk of about 30%, which is what the studies seem to show, that's a big benefit. And you don't,
especially when you consider that obviously before the evidence came out, you would assume, okay, well, smoking has a negative impact on people's breathing and lung capacity. So it's natural to assume that it would cause worse effects. You'd be more likely to get it, more likely to die. The fact that it's not only that's not true, it seems to be the entire opposite, certainly seems like something we should be looking into, right?
Yeah, particularly if it's just nicotine, because obviously doctors are never going to recommend people smoke. Really for any reason, but the chances are it probably is nicotine if there's an effect at all. It's obviously very counterintuitive that a respiratory disease would be prevented by smoking. But I was very skeptical initially. I thought it was a bit of fun, but more and more evidence has come out, all pretty consistent. So I think at the very least we can say smoking doesn't increase your risk of it. Although to be fair, I think once you've got it, I think there's certainly evidence that actually more among former smokers actually than current smokers, which probably reflects the underlying health conditions that people who've smoked for a very long time will develop. They are more likely to die from it once they've got it. But it does seem that smokers are less likely to get it in the first place. So there's not much mileage in that one for public health people. And then, as I say, the exception is, I should mention vaping quickly, because in America, having had this so-called vaping epidemic last year, once coronavirus arrived on their shores, they were very keen to try and tie it to vaping, but of course there's no relationship there either, although not that much evidence so far. And then you got obesity, where you genuinely have got an increased risk. Difficult to say exactly what that increased risk is. There's a variety of kind of estimates. Fairly reliable studies seem to suggest increased risk of dying from it once you've got it of about a third. So not trivial. It's actually not much different to the increased risk of being a man. And it's a lot smaller risk than being old or having various underlying health conditions. And of course, people with obesity do often have underlying health conditions in addition to being obese. So it's a bit difficult to separate out the obesity from the diabetes, let's say. Diabetes definitely is a major risk factor for complications from COVID. So anyway, to cut a long story short, if it's not too late for that, they weren't able to kind of weaponize alcohol and tobacco. They have been able to weaponize obesity. The fact that Boris Johnson then became pretty badly ill and hospitalized with COVID, and he is apparently obese, then gave ammunition. And we're now hearing from the deputy chief medical officer that if we want to prevent a second wave, everyone's going to have to lose weight, and therefore it's urgent that the government gets its anti-obesity strategy out so we can be ready by...
We can all lose 3 stone by Christmas.
Yeah, it's not going to happen, is it? Particularly with the kind of policies being proposed by the government.
Well, this is the issue. I mean, Boris seems particularly concerned about the link between coronavirus and obesity. As you say, possibly because he's not the fittest man in the world, and his brush with death has quite understandably terrified him. He's been reported as saying that obesity is hugely costly to the NHS and bound to improve the nation's health, but he's also committed to no new sin taxes. Do you trust that Boris will stick to what he has described as his libertarian instincts on issues like sin taxes? Or do you think the temptation to improve the nation's health is going to lead him to stray to a different path policy-wise?
I think in the short term, he'll probably stick to that. He did make a sort of semi-pledge before he became leader that he would not be, or he certainly minded not to increase any of these sin taxes or expand the sugar tax. So that would be a bit of an obvious U-turn, which I think he would want to avoid. I don't think it's really in his nature to want to introduce taxes like that, I think. But there is clearly some kind of commitment to do something. It's difficult to say because he's not really said anything publicly about this. This is kind of gossip a lot of the time. But the rumors from Whitehall are that he's taking this more seriously than he did before the pandemic, and wants to do something. And so what he seems to have done is he's brushed down the childhood obesity strategy, which is this document that keeps kind of appearing and then disappearing. And I think prior to COVID, the government was really looking to kind of forget about it all, and they were looking for a ladder to climb down. Not because they didn't want to do anything about obesity, just because the policies in it they're just bad policies. You know, you don't have to be even like a libertarian to object to the policies. They're just not practical. They don't really make sense. They sound quite good if you're chatting over a pint and you don't really know anything about the topic. But once you just dig into the details, they immediately just fall apart. They're either extremely kind of onerous on business, just not practical for businesses to do. For example, the idea that you can't have so-called junk food displayed at the exit and on the end of aisles and at the entrance of shops. Well, this is really because of people's long-standing complaints about chocolate being displayed at the checkout and pester power. Now, actually, most supermarkets haven't put chocolate at the checkout for donkey's years. Yeah. And I really don't think pester power is a big enough issue to justify legislation. But be that as it may, that was the thing that kicked it off. But at the entrance of a supermarket, have you seen the size of the entrance of the supermarket? You've got to put something there. Have you seen what the definition of junk food is? There isn't one. We talk about high in fat, sugar, and salt, and that includes peanut butter, raisins, jam. Butter, various forms of bread, most cereals. Basically most food apart from raw fruit and veg. Easter eggs. Somebody who works in the industry gave me the example of Easter eggs. Come March, the entrance of supermarkets are full of Easter eggs. And maybe that encourages people to buy Easter eggs. I suspect they'd probably buy Easter eggs at Easter anyway, but be that as it may, it encourages people to buy Easter eggs, and evidently that causes obesity. Well, there's actually a pretty good reason why the entrance. It's because they're big. They're really big, bulky products. And if you had to put them down a specific aisle, you'd need a couple of aisles. It's just not a sensible place to put things. And then think about small shops. How close to the entrance and the exit are you allowed to put these things? If you're in a small shop, are you allowed to actually put them anywhere? So there's all these kind of really fairly basic practical problems with them. And even the calorie labeling idea, which in principle is quite a good idea, I think, is in practice impossible for anybody other than the big chains to go along with. Because if you're a restaurant and you want to have a dish of the day, you can't, because you've got to have somebody do a scientific test on it to see how many calories are in the thing. And then you've got to make it exactly the same size every time. Otherwise you might risk flouting the law. Oh, this serving's got 20 more calories than it should do. So this stuff is, some of it's well-meaning, but it's nearly all overly simplistic not workable, bad, and not going to work as well. And it's not going to actually have an effect on obesity, almost certainly. The impact assessment is a joke. It's just back of the envelope guesswork. So that's the reason that successive governments have kind of picked it up, looked at it, and then kind of put it down and tried to forget about it. And now Boris is picking it up and looking at it one more time. And from what I can gather, if the gossip is correct, he's going to pick the least bad parts of it and ditch the rest, I think.
I mean, not ideal, but better than picking the worst parts of it, I suppose.
Yeah.
I mean, I suspect that the answer from both of us would probably be no. But why does the government feel that it needs to do anything anyway? Because as far as I'm concerned, the easiest way to say to people, you know, it would be better if you lose weight, is to state the quite simple fact that if you are overweight, your risk of dying of coronavirus is increased. That would do it for most people, right? That's why most people tend to lose weight, because they're worried about the health impacts. Why do we need a sort of government strategy to, you know, help us all shed a few pounds by Christmas?
Yeah. COVID-19 doesn't really change the story at all, I don't think, really, from my point of view. I mean, being obese doesn't make COVID more infectious, right? Obese people are not more infectious than anybody else. So that really is the only genuine public health consideration. You know, COVID-19 is a genuine public health problem because it's an infectious disease. And we put up with these huge restrictions on our liberty because we're trying to stop people transmitting it to other people. All that obesity does is it makes the risk to the individual greater, but health risks to the individual are greater anyway if you're morbidly obese. That's why it's called morbid obesity. So that just remains essentially their lookout. You know, it doesn't have any greater effect on the rest of society. So it's just being used as an excuse. And the same thing is happening with smoking. It's quite remarkable, really, given my yet again bad predictions at the start of this. I was kind of faintly optimistic that the fact that we've got a major epidemic on our hands and that the public health lobby, for the most part, is woefully ill-equipped to deal with it because they don't know anything about the science of these kind of things. I thought that would help put an end to all this kind of trivial nanny state stuff, partly because people would just realize how trivial it is in the face of genuine public health problem. But the public health people, there's a lot of them, there's a lot of money at stake, and they regrouped pretty quickly and they found a way to turn it to their advantage. The obesity and the various parts of the child obesity plan, one example. The other, of course, is this outdoor smoking issue.
Yeah.
So I think, I'm not sure if Wales have actually done it yet, but they look like they're probably going to ban smoking at least on the outdoor pavement areas around pubs, not necessarily beer gardens, I don't think, although I'm sure they'll get onto that later. And in the House of Lords, some of the Lib Dems, got to be Lib Dems, of course, some of the Lib Dems wanted to do the same thing. The government tabled an amendment instead saying we'll make it the law that publicans have to provide at least a non-smoking section outdoors, which is kind of a weird idea as far as I'm concerned in the first place if you're outdoors. But anyway, so I think that's going to happen, but the government's been pressured into it because, rather like plain packaging, actually, a lot of people don't realize plain packaging only came in because the House of Lords attached it to another piece of legislation, and the government was kind of in a bind about it. In the same way, the government's been in a bind on this. You know, recess was looming, and if they didn't do something on smoking outdoors, then they might not have got their whole package of legislation through at all. So they've been forced into this situation. But again, you know, this is something that the anti-smoking lobby have been wanting to do for years. Action on Smoking and Health have been not at all subtly helping out behind the scenes with these peers from the Lib Dems. And the peers themselves are saying, oh, this is a business thing. You know, we want to help pubs, and, you know, people won't go to the pub if people are smoking outside them. It's like, well, you know, we can probably see what
smokers
smokers will start, and they won't if you can't smoke anywhere, indoor and outside. But also, I think probably the people who run the pubs are better able to make that call than certainly than peers, but certainly more than Action on Smoking and Health, because helping businesses definitely isn't what Action on Smoking and Health is about. Action on Smoking and Health is about bullying people until nobody smokes anymore. So we can see that's the real motivation very clearly. This is a openly paternalistic. Act, which the original smoking ban was to a large extent. It's about stopping people smoking. Of course it is. That's all the anti-smoking lobby is ever about. And again, they've managed to capitalize on COVID-19. Something that, as we've said, smoking perhaps actually helps prevent.
I mean, the public health lobby's ability to focus on the size and calorie intake of a Kit Kat over, say, preventing infectious disease never ceases to amaze us. Do you think there's any chance, you said at the beginning of the pandemic you were more optimistic that the outbreak and the response to it would make people realise that actually we've been focusing on the size of Kit Kats and not sort of vaccine development? Have you given up all hope that will happen? Do you think they'll continue to nanny and not really focus on infectious diseases or outbreaks?
I'm giving it most hope. I think there's a lot of hope of having Public Health England reformed. There seems to be a real appetite for getting rid of Public Health England, pretty much, and rightly so. I mean, they've dropped the ball into so many different areas, every area that I can see. And also the government is keen to apportion blame. Let's be honest about it. You know, it wants to find other people to blame, but they've got the perfect people in Public Health England because they genuinely are to blame for a lot of things. Not least like completely failing on diagnostic testing and sharing information with local authorities, in pursuing a bad plan and not changing their mind when it was obvious it was a bad plan. Loads of stuff. So I think they are for the chop. It's just a question of who replaces them. I would like to see it replaced by some sort of Centre for Infectious Disease Control, which is purely focused on monitoring and surveillance and preparation for the kind of pandemic we've had, as well as doing all the other, routine vaccinations that we do, and dealing with sexually transmitted diseases, TB, MMR, all those kind of things, which, to be fair, Public Health England do supply the vaccines for at the moment. But I think a stripped down but more focused organization that only looks at infectious disease would be a good thing. And it would be a good thing, of course, from another point of view, in that they wouldn't be dealing with the calories in the Kit Kat and people smoking on the pavement. However, I don't know if that will happen in practice. I mean, I can see the public health people winning the propaganda war. They usually do. They're pretty well, they're well trained and tested in the art of media manipulation. If they can convince people that Britain had a relatively large death toll from COVID-19 because of obesity and because we're not taxing food enough, then they can pretty much achieve anything, I would have thought.
They're in this for the long game, that's for sure.
They know what they're doing, yeah.
My last question is, do you think that the government's response to the pandemic in the sort of enormous intervention in the economy and state action, as well as the kind of public health initiatives that we think are likely to come in the next few months, do you think it's going to make the general public more accepting of state action and state intervention in the long run, especially when it comes to health?
Quite possibly. I mean, certainly will, I think, in terms of the economy, which is probably an even more serious issue. I mean, I just don't know how the Tories from here on in are going to justify not bailing out every failing business, really. The amount of money is so enormous that there's already been spent. The amount that would be need to bail out the next Tata Steel or whatever is going to be relatively small. So I think they've got a job on their hands there. In terms of health, I mean, the argument that you'll hear is that, COVID-19 has killed, 50,000 people. Smoking kills 80,000 people a year, and we should be doing more about that. It's a false choice. It's a bad comparison because smoking, well, for one thing, smoking has benefits. People enjoy smoking, and so the risk is just part of a normal kind of trade-off that people make in their everyday lives. It's not contagious. Lung cancer isn't contagious, and essentially it's really nobody else's business. And the same is true of drinking too much and eating too much. But that argument will be used, that we went to the wall to try and prevent X number of people dying in 2020. Why aren't we doing more to prevent X number of people dying from obesity and drinking? So, yeah, I mean, we've moved very quickly into a kind of wartime economy and a wartime mentality in which people tolerate more restrictions on their freedom. And, how easy is it going to be to convince people that their freedom is being chipped away in these lifestyle areas where they've just been chopped away massively with the lockdown and the restrictions that followed. Probably not much. Probably people have been softened up now, and they're kind of used to being told what to do. So I think the picture is, broadly speaking, pessimistic. But that's what I say about nearly everything. I'm usually right, and I'm usually right.
That is also true, unfortunately. Not a particularly optimistic note to end on there, Chris, but thanks very much. And I'm sure, obviously, we at the IEA will keep banging this drum, especially yourself. Thank you very much to everyone who's watched and listened. I will link to a couple of reports that Chris has written about lifestyle economics during the pandemic, including a longer webinar on prohibition and the pandemic, looking at international bans on alcohol and smoking, amongst other things. You can subscribe to our IEA daily newsletter to make sure that all of our updates end up straight in your inbox. And don't forget to follow us on YouTube, Twitter, Facebook, and you can get our podcasts on Apple, Spotify, and Podbean. Thanks for listening.